Hello, everyone. It's May the 7th on Friday, and we've had 14 additional deaths that have occurred since last Wednesday. I'll get to those in just one second. We've got a lot of great news to present to you today, and we'll surely welcome your questions as well. Well, let me go into this because this is always, I think, the most respectful thing that I know I can do. You know, there's been 2,700 now. It's 2,719 total people we've lost. It's a crying shame. All I would say over and over is, please don't let these people die in vain. These people were great, great, great individuals and gave us so much, and great West Virginians. So don't let them perish and just fade away, and us not be proactive to try to do any and everything we can possibly do to pay the right respect to them. And what I'm saying about that is just this, is these people died and of this terrible killer. I will promise you this, you know, if I were one of them, as I would be fading away, I would be hoping and praying that all those that were out there would be vaccinated, all those that were out there would be trying every way they possibly could to do any and everything they could to win this war against this terrible killer. You know, my last breath, if it were me, you know, would involve a lot of prayer and a lot of thoughts of my family and all that. But my last breath would also be in hope and pray that our people that are remaining would absolutely remember me and remember the fact that really and truly we are dying in a fight against this terrible killer. And to just turn your nose up and be one of the, what we're going to call from this point forward, the hell knows, and there's not many of them, thank God. But there's some that are out there that just can't get across the finish line. It's a little inconvenient, or you don't think anything's going to happen to you, or you listen to all these boogeyman tales. But we need you to step up and take the vaccination. We need you. And so with all that, please don't let these people just die in vain. The 2,706th death in West Virginia is a 64-year-old female from Marion County. The 2,707th death is an 80-year-old female from Harrison County. The 2,708th death, I'm sorry, did I say 80th death on the second one there? Let me start all over. Again, we need to just be respectful. And if I made a mistake, I want to straighten it up. The 2,706th death in West Virginia is a 64-year-old female from Marion County. The 2,707th death is an 80-year-old female from Harrison County. The 2,708th death is a 75-year-old male from Mingo County. The 2,709th death is a 48-year-old female from Hampshire County. The 2,710th death is a 55-year-old female from Kanawha County. The 2,711th death is a 92-year-old male from Mineral County. The 2,712th death is a 63-year-old male from Ohio County. The 2,713th death is an 82-year-old female from Marion County. The 2,714th death is a 99-year-old male from Kanawha County. The 2,715th death is an 81-year-old female from Kanawha County. The 2,716th death is a 63-year-old female from Raleigh County. The 2,717th death is a 72-year-old female from Harrison County. The 2,718th death is a 76-year-old male from Barber County. And the 2,719th death is an 82-year-old male from Jefferson County. 2,719 great West Virginians. Please don't let the families and all their loved ones feel alone. We have 339 new cases in the last 24 hours. Our daily percent positivity is at 4.16. Our cumulative positive continues to drift down just a little bit, which is really good. It's at 5.14 now. Our active cases are 7,075. Our recovered cases, 145,886. Those lines on the top graph are still trending in a manner that's still doing the right thing. The wider they get, the better we are. We have 241 people hospitalized in West Virginia and 79 in the ICU units. These counties are jumping around now, and red counties are Wayne, and I think Wayne is back new, and Wirt was with us the last time, I believe. I remind you again about 65 years of age. If you happen to be 65 or older, and I would do the same thing if you're 50 or older. I mean, you heard me just read a 48-year-old that we lost in Hampshire County, a 48-year-old female. Right behind that, I read a 55-year-old female from Kanawha County. So if you're of that age or older, especially 65, and you get some kind of sniffle or cold or temperature or feeling down or tired, go get a test. Please go get a test. If we can catch it early enough, we'll save your life with these antibodies. Now, as I promised you on Wednesday, and I try with all in me to fulfill every promise and everything, that I would announce a percentage today for when we can finally, remove our mask. So today I am targeting a different type of approach, and this has come as a direct recommendation from all my medical experts, the general, and all my people. Today I am announcing we are targeting our state's 158th birthday on June 20th, that we're going to get rid of these masks. By that time, our experts tell us, using all the incentives and everything that we have in place today for our 16 to 35-year-olds, and with the exception that the CDC will also allow the vaccine for those that are 12 to 15 years of age, and we expect we can handle all that. At that point in time, June the 20th, we project that we will have 65% of all West Virginians 12 years of age and older that are eligible to take the vaccine. 65% of West Virginians will have the first dose at that point in time. 75% of our population that's 50 and above will have the first dose at that time. And 85% of our 65-year-olds and older will also have the first shot at that time. That's what we project, and that's the date we're going to go with. It just coincides perfectly with the celebration of this absolutely incredible state on its birthday. So that's the date we are projecting, and that's what we're going to move towards. And you may come right back and say, well, what if you don't hit these numbers by then? We'll be close enough. We're going with that date, period. What if you hit the numbers earlier than that, maybe 5 days earlier? We're still going with the date. And the reason we're going with the date is just this simple. If we're 5 days, from that and we hit these numbers, more power to us. That would be absolutely wonderful news. And we can surely endure 5 more days and celebrate on our state's birthday. If we don't hit the date, and let's just say we're still trending great and all that's working just really well, and let's say the date's really going to then, the percentages are really going to true up and come in line on July the 2nd. We're close enough. We'll be close enough that we can go with June 20th to get rid of the mask in public places. Now, it'll naturally be your choice, whether you're going to have the mask or not, but the mandate will be lifted. Now get this. The average age still in West Virginia today is 34 years of age. That is the average that is coming back positive. So we've got to know that our young people are now we're going to really expect them to step up. You know, if you'll think about this though, just for a second. We project on June the 20th that we'll have 75% of our population with one dose. I'm sorry, of our 50-year-olds with one dose. 75%. We project that we will have 85% of all those older than 65. Now just stay with me. It's important to remember that 97% of the deaths from COVID are West Virginians 50 years of age and older. If we have 75 of them, 50 and older, that have received the first shot, and 85 of those 65 and older with the second shot, we're good to go. We're good to go. You've done one whale of a job, West Virginia. You really have. You've led this nation over and over and over. In a state with a really, really, really old population, I think the second oldest in the country, I think that's right. You know, and a state that abounds in all kinds of chronic illnesses and everything, doesn't have an ocean to protect you, absolutely border states all around us. And yet, look what you've done, West Virginia. You have led this great nation over and over and over. You know, President Biden is trying to target July 4th, and we can surely beat that. You know, so nevertheless, that's our deal. We're going to call this our call to arms. It is exactly that. We need the arms in a different way. We need the arms to put shots into. So this is West Virginia's call to arms. And we're going to absolutely target and achieve these things, but we need your help. Now, let me just step back and just tell you just this. And I want everybody that's on here, and there's thousands probably that are watching, please understand just this. You've got family members that are 16 to 35 years of age. Absolutely all those, we've incentivized all those people are going to pick up $100 for just absolutely going along and trying to help us. If those people don't get a shot and they do contact COVID and they can do it without even hardly knowing it, if those people end up there's real chances that they could end up with these things happening. They could end up with future side effects that could cause them real health issues, can they not? I'll promise you, all the medical community says just that. The other thing they can do is they can bring this home, and there'll be someone somewhere that hasn't had the full vaccination, and they can bring this home, and who knows the tragedy that they can cause to happen by them saying, oh no, I don't want to do that. You kidding me? Are you kidding me really and truly? That, you know, somebody in the household or somebody that you know across the street hasn't had the vaccine, maybe for whatever the reason, maybe because they have issues that their doctors say you can't take the vaccine. And a 16-year-old hauls this terrible disease right into the house or right into the neighborhood, and boom, you know, we have a real issue. We have someone else die. Now, come on, grandmas. Come on, granddads. Come on, parents. Help me, because these kids can have bad events happen to them too. Right now, the average age that's testing positive in West Virginia is 34 years of age. That means a pot full of them that are 16 to 22 or whatever like that are positive right now. We have got to get them vaccinated. Now, you got to help me. You got to help me. I know you're already doing it, and I know you've led the way in every way. Now we're on a celebration of call to arms, that on June 20th, we're rid of these things. But I got to have you help me. I really have to have you get me across the finish line. We don't know about the 12 to 15-year-olds yet. CDC is still looking at that, but we're ready to go. We're ready to go, and we'll get those kids too. So again, I'm just asking for all your help. I'm not going to belabor it anymore, but I need you, West Virginia. And you've done so good. Keep on keeping on and everything. And whatever you do, going back to the 16 to 35-year-olds, I mean, for crying out loud, if really and truly, if you've been vaccinated, you're going to get whatever we come up with, that's $100 value, whether it be that, a gift card, whether it be that silver dollar or the savings bond. I don't know exactly that yet, but we're working it, and it's complicated because it's just different than what it used to be a long time ago. As far as Everbridge, we're going to change a lot of things we're doing within Everbridge. It has absolutely been an incredibly successful tool. And if you go back and just think of those people that said, I made 160 calls today over and over and over. We had people sitting and calling and calling and calling, trying to get registered to be able to get their shots, spending an enormous amount of their time doing that. We at Everbridge has served its purpose in many ways. We just recently used Everbridge to come up, I think, with 923 additional folks that we could get vaccinated. We're going to use Everbridge in a different way, and I think Dr. Marsh or General Hoyer can better explain that we don't need to keep going through the same registration process that we've been in before, but they'll explain more about that. But Everbridge has served us well. We have 84% of our total administration, for first and second round shots, for this week, and our goal is always 100%. We have over 2/3 of the West Virginia residents that are age 65 and above that are fully vaccinated. We have 79.7% of them. Gosh, it's unbelievable. It's so good. I mean, that is so good. But we have 79.7% of our over 65 years of age that have received the first dose. And if you're 65 years of age and older and still waiting to get a vaccine, call us. Please call us. Look at that right up there just 1 second, if you would. Look at the total population, look real close and everything at the total population of 65 years of age and older in the state of West Virginia. 367,011 people. 367,000, and we have first doses in their arms of 292,341. I mean, it's great. It's just great. And honest to goodness, without any question on the planet right now, if we had not moved when we did, a bunch of those 292,341 have been dead. And so we saved a bunch of lives. There's no way on earth that we can be anything except proud of ourselves in West Virginia and proud that every one of those people stepped up and they've got their vaccine, and keep on doing that. Our businesses and our churches and everything, we plead with you. Call us and we'll set up a vaccination clinic at your place, and we'll get your employees or your congregation. Our vaccine info lines up, vaccine reminders over and over. Quit being afraid of this vaccine. I don't know how many times people are going to have to tell us over and over. They're telling us and everything of the incredible success and the incredible safety of this vaccine. I go back to India. Just think, what would those people give to have the opportunity that we have in America today? What would they give? I mean, for crying out loud, they're dying like flies. What would they give? Would there be one person in their community, one person that wouldn't take the vaccine? I'd be willing to bet no. I'd be willing to bet that they wouldn't have one. And literally, absolutely, they would run to be us. And so if we're this blessed, let's just don't turn our nose up at this. Surely to God above, we don't need to be one of the hell no's. And on top of that, we can absolutely get there if you'll just take the time out of your busy days and everything to be maybe inconvenience just a moment to get your vaccine. The testing's all up there. Our free testing map's all up there. We thank Frith and Walgreens for all they've done over and over and over. You've got to utilize that free testing. You have got to continue to utilize it because we can't possibly know of an issue unless you're tested. We have 16 outbreaks now in our long-term care facilities. Not good. We got to do better than that. We have 9 outbreaks in our church community in 7 counties. That's Berkeley, Grant, Greenbrier, Hardy, Jackson, Nicholas, and Ritchie counties. We got to do better in our church community again. We got to do better in our long-term care facilities. We have got to do better. Now, come on, West Virginia. You absolutely have shown me what you can do. We got to do better. Now, think about this number for a second. In corrections today, now think about this. Just think. Do you know how many inmates all across corrections that were tested positive today in West Virginia? 4. Isn't that incredible? Isn't that an incredible job? Absolutely 4 people. So all those that are involved in corrections in every way, gosh darn, thanks so much. Way to go. 12 staff cases and 4 inmates. That's it. Tell you over and over, we got a little ways to go. Wear your mask. Wear your mask. It's going to help us. It's going to continue to help us. And then we'll have a big celebration. Wear your mask just a little while longer. Give blood. We need you to do that. And remember all of our vaccination clinics at all of our state parks. As part of the ongoing efforts to get more West Virginians vaccinated, we are going to hold free vaccination clinics at all West Virginia state parks between now and Memorial Day. Before Memorial Day, we are going to start with several high-traffic parks, and we'll add more as needed. On Memorial Day, all West Virginia state parks and forests will offer vaccines to employees, families, and park guests. The clinics will be set up at a central park, or a central place and everything, outdoors, and all the details are posted on our West Virginia stateparks.com. Now, let's absolutely pin our ears back, work as hard as we possibly can to get more and more and more people vaccinated. Again, I thank all those that are jumping in and trying to help, whether it be all those folks in Kanawha County in the health departments and everything, Sherry Young and all the great work she's been doing and everything. I thank absolutely all that's going on in our state parks. Especially thank thanks about the special needs clinic and everything. But with all this, I can never step back and not thank all West Virginians for all the great work that they continue to do. Without any question, we're getting there. But just think about how our broadcasters stepped up. That's good stuff. And I thank them more than they'll ever know because they're trying to help us help you, West Virginia. And so as we do that and step up together as West Virginia, it's really, really, really good to be arm in arm with somebody pulling the rope right with you. So thanks again to the broadcasters and thanks again to everybody. Appreciate you. Thank you.
All right, thank you, Governor. Let's now go to Dr. Clay Marsh, our coronavirus czar.
Well, good afternoon, and the governor has really, I think, articulated a very important date for all of us in West Virginia. Our state's birthday as a day of celebration, as a day of remembering the great people that preceded us, that served the state so well. And in our Call to Arms program, we are once again calling on all West Virginians to help us reach these goals of the percent of our population vaccinated with at least 1 shot. And as the governor said, when you look across the world and look at the countries that are doing the best job of immunizing, particularly Israel, they saw a huge beneficial point of inflection when they got to 60% of their population vaccinated. And given the very good follow through of all West Virginians, then as we target 65% of our vaccine eligible population with at least one shot, 75% of our over 50-year-old population who's vaccine eligible with at least one shot, and then 85% of our over 65-year-old population with at least one shot, we believe that we will then have the ability safely to be able to remove the mask mandate. And as the governor said, we see the spread of the United Kingdom variant of COVID-19 continue to grow in West Virginia. We know that that's the most common form of COVID-19, and we know that this spreads more easily than the form of COVID-19 that we faced in 2020. And this particular form is targeting younger people. We see the highest number of positive cases in the 10 to 19-year-old age group. And when we look at variant spread, the spread of the United Kingdom variant of COVID-19, we see the highest spread in the 10 to 29-year-old age group. And so as we are focusing then at making sure that West Virginia is a safe place to be, we are also calling on all of our younger West Virginians to serve the rest of our citizens by choosing to be vaccinated. That helps you live a more regular life, helps all of us live a regular life, and gets us to the point where when the masks come off, that we'll all be safe. And it's important for people who still might have anxieties, even after being vaccinated, that certainly you could still wear a mask. There's no reason not to if that's what you feel like. But being completely vaccinated and being 2 weeks out from vaccination is very, very protective, even against the United Kingdom variant that we're seeing. So it is very important that we all pull the rope together, as the governor said. We have done very well. We've been a beacon for the country, and we have one heck of a celebration ready to go on June 20th, where once again, we celebrate our caring and service to each other and to this great state. So thank you.
All right, thank you, Dr. Marsh. Next, we'll go to Major General Jim Hoyer, the director of our Joint Interagency Task Force.
Good afternoon. As the governor pointed out, and I want to just highlight a couple things. Secretary Crouch and his team have done an excellent job with Everbridge system and working with it to get to the things that we needed. What we as a pandemic leadership team have recommended to the governor is we can now no longer have to use the central registration process in Everbridge, because we have vaccines abundantly available across different methods, whether it's pharmacies, health clinics, and now we are entering into efforts with primary care providers. We will continue to use the Everbridge system for messaging. Some folks may have in the last several days received messages from Everbridge as we continue to press out the notices to get the vaccines. Second, I want to point out that West Virginia is one of the leaders in the nation in its citizens stepping up and getting their second dose. So we know once West Virginians get a first dose, they go back and get their second dose. So we'll continue to press that and make those second doses available. The third thing I want to point out is that, as the governor talked about, we are going to continue to press through June 20th with a variety of activities, to include pre-planning going on with tourism and DNR on our state parks. We are working with the Department of Education and our local school boards. As soon as 12 to 15-year-olds are eligible for the vaccine, we will start that day or the next day with delivery of vaccines to those. And we are going to open up at the governor's direction to make sure that when we do clinics in schools, they are available not just to the 12 to 15-year-olds, but to entire families who still may have not gotten the vaccine. Last thing I'd like to leave everyone with is the challenge that we've put forward and the sacrifices that have been made From a military standpoint, tomorrow is the 76th anniversary of the Allies signing the agreement for ending the war in Europe. Victory over Europe Day, VE Day. Go back and look at in the war, in that war, World War II, 418,000 Americans died during World War II over that 4-year period. To date, in just over a year plus, 580,000 Americans have died from COVID. I think about my grandparents and the generation and the sacrifice that they made. So along with the governor, I would ask everyone to step up and help us meet that challenge for June 20th. Let's get everybody that will get a vaccine in West Virginia vaccinated, and let's get back to normal. But it's time for us all to step up, make that simple challenge and sacrifice, get the vaccine, and protect our fellow West Virginians. Thank you.
Thank you, sir. Next, we'll go to Secretary Bill Crouch with the DHHR.
Hello, everyone. May is National Mental Health Awareness Month. Although we tend to focus on our physical health, our mental health is vital to our overall well-being. This last year has been difficult for everyone. It has been a time of isolation and a time of loneliness for many. According to recent morbidity and mortality weekly report from August 2020 to February 2021, the estimated percentage of adults with recent symptoms of anxiety or depression increased from 36.4% to 41%. Additionally, the percentage of those reported on unmet mental health care needs also increased. If you are experiencing acute stress that gets in the way of daily life for several days in a row, please contact your healthcare provider. Additionally, mental health in childhood means reaching developmental and emotional milestones and learning healthy social skills and how to cope when there are problems. This week is Children's Mental Health Awareness Week, and Governor Justice has proclaimed today, May 7th, as Children's Mental Health Awareness Day. Our children can suffer in many different ways. Please remember there are resources available out there. Thank you all.
All right, thank you, Secretary. Next, we'll go to Dr. Ayn Amjad, our State Health Officer.
Good afternoon. I did want to address some of the misinformation that is with the COVID-19 vaccine. We do know there's a lot of concerns about the vaccine out there, so I do want to address some of them. There is no information out there that the CDC has found or the research material that the vaccine causes infertility problems. We are seeing a lot of concerns about that, and while we do understand the misinformation and a lot of questions that we have from patients, that we do want people to realize that there's no information that it does cause infertility problems. So that's one thing that we're hearing and seeing out there. But we do know that if you do get COVID while you're pregnant, that it can cause a lot of miscarriages and other issues. So we do encourage people to get the proper information when they're discussing or having the issues about any hesitancy or concerns they have about getting the vaccine. But that's one issue. We do know that right now getting the vaccine can reduce your chances of getting into the hospital or any other problems that you have. But there's a lot of misinformation. So we encourage you to visit our website to get proper information from the CDC. But right now, getting the vaccine is the best tool we have to get over this pandemic, especially right now with our young people. And we do encourage you to get as much information as possible. Also, there's another misconception that it can alter your DNA. That is also untrue. So we want people to realize that as well. But if there's any other concerns, then to visit our website or the CDC's website for proper information. Thank you.
Thank you, Dr. Amjad. We'll now go to questions from members of the media. The first today from Mark Curtis with Nexstar Media.
All right. I think it's okay to have a lighthearted question and then a serious one. You know, it occurs to me that every year on the state's birthday on June 20th, they have these big free cupcakes at the Culture Center for the birthday party. And of course, it didn't happen last year because of the pandemic. So will the cupcakes be back? And on a more serious note, how close can we get to that target date of June 20th, and you still have the right to change your mind? I mean, if the numbers aren't there on, say, June 15th, might you pull the plug and say we're going to have to keep the mask mandate a little longer? Or is this a pretty firm, set in stone date right now?
Mark, I think it's set in stone. You know, we'll be close enough. You know, we'll be close enough for sure. In fact, I really believe, you know, if you had all the dialogue that I've had with the medical team and everything, you know, we may actually even get there a few days before. But if we do, we're still going to celebrate on June the 20th and everything. But and the other thing is, I got to tell you this. You know, you always talked about the cupcakes. I'll never forget this. I'll never forget being over at the Cultural Center, and I think that it was on the state's birthday and the celebration and everything. But they had cupcakes there, and this little beautiful little girl, you know, came up and gave me a blue cupcake, had blue icing on it. I took a great big bite of it and everything. Of course, then I inhaled the whole cupcake in the next few minutes and everything. I ended up with blue all over my mouth and all over my teeth and everything, and I couldn't get it out and everything. But so there's a lot of pictures taken with me with blue teeth and blue lips and everything. But you know, no, we're going to have the cupcakes. We'll enjoy a cupcake together. And without any question, I think that date's firm. And, you know, in this situation, we've all got to realize that anything could happen. I mean, this thing could whiplash on us and be really terrible. And then we'd have to do what we've done in the past, and that's pivot. And we all know that, you know, there could be something, event really bad, but we're on a good path right now. And we just got to all encourage every single person to get vaccinated. So help me with that, and we'll eat those cupcakes and all be good.
All right, thank you, Mark. Next to Charles Young with WV News.
Hi, this is Charles Young with WV News. I was just wondering if setting the goal of 65% means that we think that will be our ultimate vaccination ceiling. Do we think that that is the most we'll be able to do, or are we kind of conceding that we think there's about 30 in the neighborhood of 35% of the population that just, no matter what incentive, no matter what program we put out there, just won't be vaccinated? Thank you.
No way, Charles. It's no way. You know, we call those people, you know, and really this came from General Hoyer, but we now are calling those people the hell no's, you know, and the percentage is nowhere close to 35%. But you've got people out there, Charles, that are still those people that are kids that just, you know, I mean, you got a high population of the kids and everything that just think they're invincible, and they're just so busy and they're running in all kinds of different directions. And then you've got a bunch of folks that really and truly would gladly take the vaccine if we can just make it convenient enough for them, because they're running and doing all the things that people do in life and everything. And then you have people that, you know, are scared. You know, they want to take the vaccine, but with what happened with Johnson & Johnson and everything, you know, it scared them, you know, and so you've got some, but it is a really, really significantly lower percentage than 35% that are the hell knowers. I'm not taking a vaccine no matter what in the world happens to me and everything else. And a lot of them have had some really bad events happen to them. A lot of them aren't with us right now, you know, but you've got a percentage of that. It's not 35%. It may be 15%, but then you've got a lot of just convenience issues that we'll continue to market, will continue to be out there, and we hope that 65 just continues to rise and everything. But that 65 is not hitting the wall. I mean, that 65 can be a whole lot better than 65.
All right, thanks, Charles. Next to Paul Mullen with WCBC.
Good morning, Governor. Good morning, everyone. I want to go to Secretary Crouch's announcement of the mental health component and how important it is, especially this month. When we look at the pandemic, a lot of people spend a lot of time by themselves. And I'd like to know, and perhaps Dr. Amjad can chime in on this as well. A lot of people may be experiencing symptoms and have no idea what that's supposed to feel like? And is there a time period that you have to say, well, I'm not going to get any better from this, and yeah, the pandemic is easing and I'm getting out of my house again and I'm still not feeling okay? Is there a telltale way to indicate to people that they ought to seek services now? Thank you.
Well, Paul, let me just, before we go to Bill, let me just say this, that, all those folks that are out there that have any issue, whether it be mental health or whatever it may be, that, we absolutely, we need to focus, we need to help, we need to do everything we possibly can do to help them. And, but Bill, you take it from there, and you can answer these questions probably better than I.
Well, thank you, Governor, and thank you, Paul. That's an excellent question. We've talked a little bit in the past about how difficult this pandemic is for folks, and especially folks with FUD, which you've asked questions about before. There's no set rule with regard to when to seek help. The rule is, if your anxiety from your own perspective is such that you feel like you need to talk to someone, you should seek out a professional, behavioral health professional in your community to do that, your family physician or others. There are many resources out there throughout the state. We have those on the DHHR dashboard. But individuals who are experiencing that stress, especially from loneliness, especially from the inability to, over the past few months, to really connect with people that you have consistently connected with over the months and over the years, it is a difficult time for everyone. So it's a great question. The rule is just simply, if you're feeling overwhelmed, then you should talk to someone. You should seek out some assistance, and you should look at the DHH website or your local physician or local health department and get some assistance on that. So again, that is a terrific question. We'll try to push out those numbers. We do that at every press briefing. The governor talks about this often. There are resources out there. There's information available for folks to connect with people. So we'll try to do that even more. So thank you, Paul.
All right, thank you, Paul. Next, we'll go to Veronica Obey with WDTV.
Good afternoon, everyone. With those who are fully vaccinated and they're waiting for that June 20th date, what are recommendations as far as when it's safe to not wear a mask and when you would recommend to wear a mask? And even after the June 20th date, will there be any recommendations for when a mask should still be worn? Thank you.
It's Veronica, is that right? Well, Veronica, thanks for being with us. And all I would say is just this, let's just continue. I'm fully vaccinated, but if I go in a public building or whatever like that, I'm wearing my mask. And so let's just, as people that are fully vaccinated, I spoke of a great friend of mine that was around my basketball team with both vaccinations and ended up positive COVID. And he had a little bit of a tough time. But thank God that he had the vaccinations and everything, got through it, and that's really good. But Veronica, I would just tell you just this. If you go outside, you don't need the mask. I'm speaking to those that, that are absolutely fully vaccinated. If you go in a public building, wear your mask. Support us in every way. And let's just all keep pulling this rope to a June 20th deadline. Clay, maybe Dr. Marsh, if you could add anything to that, please do.
Well, thank you, Governor, and thank you, Veronica. So the Centers for Disease Control have pretty specific guidelines about what they recommend for mask wearing, which basically is, if you're around other people that are 2 weeks from full vaccination, nobody needs to wear a mask. If you're around your near family and nobody has high risk exposures, then nobody needs to wear a mask. If you're outdoors, as the governor said, you don't need to wear a mask, with the potential exception that if you're in a super crowded area with people who haven't been vaccinated, the CDC does recommend still to consider wearing a mask. But as the governor said, you should feel very protected with your full vaccination series. Indoors, that at this point, the CDC still recommends wearing a mask unless you're in the environment with other people have been fully vaccinated or a near group of family members who you know have not had high risk exposures. But I do think that the important thing to note is that if you're vaccinated, when you're 14 days after the final vaccination, you are amazingly protected against getting COVID-19 from the United Kingdom variant or other variants, and you're amazingly protected, almost 100% protected from getting really sick, getting hospitalized, or dying. So vaccination is so important to protect yourself, to get back to the life that you want. And as we look at the birth date, we believe that when we reach those goals and metrics that the governor has laid out, that we will be a very safe place for people to be in West Virginia.
Just one second, Jordan. You know, I've told this before, but I told you the story about 3 coaches with their basketball team and about beautiful young ladies, you know, 15 to 18 years old. And now they've coached through the whole season, and now we're right at the brink of we just started the state basketball tournament. We won our first game, and then right behind that, we end up with a kid that didn't play in the game, but is a freshman that aspires to be a great basketball player and a great student and great person. Ends up positive. So then we drill down a little deeper, and we end up with another kid on our team positive. And then in the going days, we have lots of kids on the team. You know, the kids are quarantined and everything, and lots of kids on the team that are not together at all. Then we have 5 more that end up positive. Now, we only had like 17 total kids there, or maybe it was 15, I'm not sure, because we had, you know, some kids, we can only dress 15, and at that point in time, you know, we're probably down to 15 kids. And so with that, we've almost got half of the whole population of the team that is tested positive. Now, of course, naturally, the right thing to do was we could have taken the other half of the team and come down and played GW, but that's not the right thing to do at all. You know, really and truly, what we did is we did the honorable thing by saying, we're done. We're done. You know, and we had to be done from the standpoint of, surely to goodness, this could even get worse and we could spread even more. And so with all that, the best thing that I need to tell you, and I had to pre-reference it, you know, or prerequisite one more time, it's just this. You had me on my birthday turn 70 years old. You had the governor of the state of West Virginia that was right with those kids over and over and over. You had the governor of West Virginia right with kids that half of them had COVID. Now, you also had 2 assistant coaches that were significantly older than me that were right with those kids at the same time. All of us had both our vaccinations. And all of us were wearing masks all the time. All of us, all 3 of us had both our vaccinations. Half of that population of kids right in front of us, right with us, as we were with them in the gymnasium over and over and over, half of those kids had COVID. Now, I read to you the deaths over and over and over and over. What if we had not been vaccinated? What if we had not been vaccinated? Really and truly, you can't take the chance. You can't take the chance. Whether you're a kid or whether you're an adult or whether you're a 70-year-old governor, you can't take the chance of being exposed anywhere. Please get vaccinated. Please, please, please help me get all of these kids and all of us vaccinated. It is our ticket. Anyway, I hate to take up your time, but keep wearing your mask until the 20th, and we're going to have a big celebration.
All right, thanks, Veronica. Next, we'll go to Brendan Tierney with WSAZ.
Good afternoon, Governor and panel. I have two questions, both related to businesses and how they're impacted by this. First of all, if there is a small business out there, say a Kroger or just a mom and pop shop here in Charleston, that feels safer with their customers and everyone inside wearing masks, are they still going to be allowed to require people wear masks even after the mask mandate is lifted on June 20th? And then also, there's many of these businesses that are struggling to find employees to come back. And there was a national survey that came out this week that said many of the reasons employees aren't coming back, first of all, it's that increased unemployment benefits, as well as people that are afraid of contracting the virus. What would you say to those people that aren't going back to work because of those reasons, as well as those businesses that are struggling to find employees right now? Thank you.
Okay, Brendan, first of all, the first answer is easy. If you're a private business, you do what you want to do. I mean, the government mandate will go away, but if you absolutely want to mandate the customers coming in and out of your store have to wear a mask, you can absolutely do that. That's all there is to it. You know, and the other thing, as far as talking about, you know, businesses struggling and having a hard time finding employees and everything, you know, that's a national problem. That is a big time national problem, you know. And here's what I'd say, and I'd say just as straight up as I could say it. One is you got a pot full of people that are receiving benefits on top of their unemployment benefits from the federal government that are deciding, well, for God's sakes of living, you know, I'm better off just taking the money and I can go trout fishing. I don't need to go to work. Well, first of all, it's not a real patriotic move, and the government is just trying to step up and help and everything in every way. And who knows at some point in time that the government isn't going to maybe advance that September date back and say, no, we're not going to continue to do this after July or whatever it may be. But I truly believe, I really believe, in my heart at least, and I believe this, Jim Justice could retire right now and not have a worry and just hang out and everything else. I don't choose to do that for one reason and one reason alone. I believe that the good Lord above made me Jim Justice for a reason. And he expects me to perform. Well, and so that's what I do. Now, that's my belief. I'm not imposing that on anyone, but that's what I think. And as long as he gives me breath, I'm going to keep working. Now, I can tell you to be selfish and to opt out, to stay home because the government's just sending you money. Well, if you choose to do that, you choose to do that. I don't think much of it. You know, our businesses need you back on the job, and they need you back on the job right now. You know, from the standpoint of how we bring those people back, that's a different thing. We can't communicate it any better than what I've just said. But I would say this, Brendan, and the last thing. If you're afraid, if you're really afraid, and that's why you haven't gone back to work, because you're afraid, go get vaccinated. What in the world are you talking about? If you're genuinely one of those people that really is afraid to go to work, well, get off your butt and go get vaccinated. And then there isn't any afraid. Absolutely go get vaccinated.
All right, thank you, Brendan. Next to David Beard with the Dominion Post.
Hi. I'm going to preface my question with just kind of an observation. My mind just went blank. Sorry. Okay, yeah. I'm sure there are some iffy people who've been vacillating about the vaccination who might choose to rationalize this June 20th date and say, well, I'm not going to bother getting poked now because I can take my mask off anyway. That's probably inevitable, and I'm sure that entered into your discussions. But my question is this: so many aspects of the pandemic have evolved, and we used to talk about herd immunity being somewhere 70 to 75%. Dr. Marsh today mentioned Israel's an inflection point of 60%, and our number is 65%. So I wonder if we could talk about, has herd immunity evolved in some way? Has that number migrated down, or have we just evolved beyond that, the need for that discussion? Thanks.
Dr. Marsh, this one's you.
Thank you, Governor, and thank you, David. As we think about herd immunity as a concept, then the variants start to change some of those numbers. The numbers now are probably 80 to 85%. But there is an important issue that you're bringing up here, David. So as we are experiencing in real time the pandemic in West Virginia, in Israel, in India, in the rest of the states in the United States, we go from making projections and looking at things in academic terms like we have projected herd immunity, and we start to see what real world evidence is demonstrating to us. So we're following our own data and we're tracking real time, real world data from other places. And what's important about that is that we know that there's a number of variables. For instance, there's a variable about how many people have been vaccinated. And we've talked about that, at long lengths. And that is the solution for the COVID pandemic issues that we are facing acutely in West Virginia and in the world. But it also involves how many people are immune from previously having COVID-19. Now we know that people that have had COVID-19 can get reinfected and can get sick from COVID-19, whereas people vaccinated appear to be much better protected for the longer term. So we very, very, enthusiastically encourage everybody who's even had COVID-19 to go ahead and get vaccinated as well. We also know that it is also influenced by the type of COVID-19 virus, the particular strain. Variants just mean more COVID-19 viruses that have additional beneficial properties, like the United Kingdom variant, and it's easier to infect people, about 50% more likely to infect. And we see children now becoming infected because of that virus. So we are tracking real world data, and the real world data tells us when you get to about 60% of your population who's immunized, then you start to see things really fall down. And even as you open things up, they continue to stay down. So we believe that these are the right targets for West Virginia. We know that keeping the state together is critical. And we continue, as the governor just said, to track these every day, all the time. And we've always said we're in a learning mode. We want to be flexible. We want to be agile, but we also want to return life back to regular life for all West Virginians absolutely as soon as we can.
All right, thank you, David. Next, we'll go to Phil Cap.
Jordan, come back to me just for a second. Well, I'll wrap it up. And then go ahead. Keep going.
All right, next we'll go to Phil Kabler with the Charleston Gazette-Mail.
Hello, everyone. Governor, I wanted to follow up on a question from Wednesday. And we know governor is an important job, and there are times when scheduling conflicts are inevitable. But in all the time we've been doing these briefings now for 14 months, you've been perpetually tardy to every single briefing, including over an hour late on Wednesday and 17 minutes late today. Can you explain yourself?
Phil, I don't have any idea how to react to you. Today I was doing a Newsmax thing. There's things that come up constantly. And I was asked when we had our first briefing. I was asked in that briefing by a reporter, when I said, we're going to be here tomorrow to do this, and the reporter said to me, well, are you going to be here? And I said, I'll be here. And I have been here every single briefing that we've had. Now, I don't know how many that is, but it is a tremendous number. And absolutely, I will continue to be here every single day, every single time. Now, there may be interruptions and everything else. And like I told you on Wednesday, I said at that point in time that I was operating under the situation that the briefing was at 1 o'clock. And if anybody made a mistake on that, I'll take responsibility. But absolutely, Phil, I've been here. I've been here with you every step of the way. I'm glad. I am so, so glad that what you are doing in life is able to keep up with a clock, and it's really, really good that you're able to do that. Phil, you are the epitome of Pee Wee goes to the big top. The epitome of that, in my opinion. You said at one time that you are my arch nemesis. And Phil, honest to God, you are a gnat on a dinosaur. That's all there is to it. But you have an incredible responsibility to our state, that you have failed our people over and over and over. And on top of all that, you have done it for years and years. We will be so blessed when you go down the road. That's without any question, period. And the other thing is, in every single thing that I have done throughout my life, I have never one time made fun of somebody's handicaps or somebody's inabilities. You did the most disgraceful thing in the world, making fun of people that were handicapped, people that had absolute issues here at the Capitol, good people that absolutely take care of our building in every way. You absolutely made fun of those people and then went on to do it in social media. Absolutely the most degrading, humiliating thing in the world. How in the world could you possibly do that? And then how in the world could you possibly turn your back on foster kids, of all things? You did both of those. I wish to the Lord above that I would not have done this. But remember what I did in the briefing. You, on the briefing, were crying and pleading with everybody to have mercy and forgive you. Pleading to give mercy and forgive you. Now, really and truly, what did I do? I said, everybody deserves to be forgiven. Everybody. That's what I did on that very day. I wish to goodness now that I could have taken that back and every day beat on you and beat on you and beat on you until your employer decided we don't need you in West Virginia. We don't need somebody that has that much evil in them in West Virginia. Phil, you do whatever you want to do. You're a nothing to me.
All right, Governor, I'll turn it back to you to close out.
I think today we have so much to celebrate. We have done so much good, and I'm speaking of you, West Virginia. I am so proud of you. We have so much to celebrate that we're on the glide path now to get rid of these masks. We have so much to celebrate that over and over the Newsmaxes or whomever it may be of the world is calling to talk to me about what you've done in West Virginia. They just got through doing it. That's why we were a little late today with the briefing. They were recording, something that's going to run tomorrow. I asked you to watch it. Without any question, you have done it, West Virginia, over and over and over. We announced today we're on that glide path. I'm very, very proud to say that we're on a glide path in West Virginia to get rid of our mask. We have protected our people to the very best of all of our abilities. And with all in us, we should be very, very proud of what West Virginians have done. I knew you'd do it. I knew you'd do it all along. I really did. It's the very reason that I ran for governor. I've told you that over and over and over. I don't want anything. If Phil Kabler and the Charleston Gazette choose to to absolutely listen to the sermon and say, you know, Governor, you had a button on your sleeve that was cracked. You know, if they do that just to look, to try to seek some level of vile and evil and all that, well, let them. But you know, West Virginia, what we're doing. You know exactly what we're doing. And absolutely, it's been an honor beyond belief. And I'm going to keep on doing everything in my soul to do the right things for all West Virginians. Doesn't matter, rich, poor, black, white, Democrat, Republican. It doesn't matter to me. All I want is goodness for you. And so let's just keep doing it. Let's keep doing it. And thank you so much. And we're on a glide path now to get rid of these masks and do a lot of things. But come on, West Virginians, just suck it up and be really tough now and help me get these people vaccinated. Thank you so much.